Sue Lawes, our regional convener for Unison in the West Midlands. Today is our regional health conference where we'll be discussing all sorts of issues around cuts to the health service and the potential privatisation of the health service.
Hello, I'm here at the West Midlands Health Conference. I hope you can hear me because there's a lot of buzz going on in the background. This is the end of a very, very exciting week where the West Midlands have been out recruiting under 1 million voices and our health, our NHS. And this morning I'm here to discuss with everybody what's expected in the white paper and how the West Midlands can respond and mobilise so that we challenge it, that we use the opportunity to recruit and to equip everybody with the arguments to get out there and let the community know what's going on. I'm really excited about this morning. Well done, West Midlands.
I mean, we spent this week going around a lot of hospitals in this region, trying to get people to join us, but also trying to develop our organisation on the ground, trying to get more stewards and trying to raise some of the issues that our members face every day, but also try and raise some of the big political issues. Because I tell you, I mean, you all know this, we haven't won the arguments at all where we say that these cuts that the government are making, and by the way, you'll all be really pleased to hear that the NHS is apparently safe. You know, you haven't got to worry about any cuts at all, jobs, wards, you're dead safe apparently, but that's not the message that you've been giving us this week. It's not the message that we've been picking up at all. We know what's actually going on out there with the weasel words that somehow everything is okay, and yet you're having to do more every day. Our members are having to do more every day. More pressure on service delivery every single shift.
Now, I think this conference in relation to the health service, nationally, in the Midlands in particular, is very well timed. Because let me start by being frank about, I think, the problem that we've got. The biggest problem that we've got is to condemn government in power. But right now, the general public believe that the NHS is safe in their hands. They have bought the line that health service spending is being protected, that services likewise will be protected. They haven't begun to understand either what's happening already and will happen increasingly in 2011, including frontline services being cut on the one hand, and on the other hand, I don't think they've begun to recognise the damage that will be done by the upheaval of GP commissioning on the other hand. I think our task, therefore, today is Unison and the Labour Party together, is to prepare now for what will be a bitter 2011 and 2012 as we fight back against the government, and in this case to protect the National Health Service.
Today we're at our regional health conference. We haven't had one for a while, but this one has come about through Roger and Franco. And I must say it's been really brilliant. We needed it. I think it's fired on our members now to go out there and to take the message through to branches and out. And the most important thing about is the community. Get out there to the public to let them know what is actually happening to the NHS.